So welcome everybody. Thank you all for taking the time today to be here at the February 2026 Safe Advisory Committee meeting. I'm going to call the meeting to order. As you all know, I'm Rachel Henderson, Safe Program Manager, and for meeting record, I'm currently the acting chair for the Safe Advisory Committee. Thank you everyone for being here for the first of our 4 meetings this year of 2026. I'd like to just begin with voting member introductions. You can start by sharing your name and the organization you represent. We'll go through, I'll call you across the screen, and then we'll do guest introductions after that. Just starting at the top, State's Attorney Platt, if you'd like to give yourself a little introduction, I'd appreciate it.
Hi, I'm Maureen Platt. I'm the State's Attorney for the Judicial District of Waterbury. It's great to be back on this committee again and try to support you in all the wonderful and meaningful work you do in protecting victims or survivors of sexual assault and bringing some semblance of justice.
Thanks, Maureen. We're glad to have you. Marielle?
Hi, everybody. Marielle Daniels, the Director of, sorry, I can't talk. I'm the Director of Regulatory Advocacy for the Connecticut Hospital Association and been a part of this group since its inception and pleased to be here. Thanks.
Beth?
Good afternoon, everyone. I'm the Executive Director. My name is Beth, Hamilton. I am the Executive Director of the Connecticut Alliance to End Sexual Violence. We often are the folks who are going out and meeting with survivors in emergency departments along with SAFEs and represent the 9 community-based sexual assault crisis programs throughout the state.
Kristen?
Hi, I'm Kristen Loringer. I am one of the SAFE nurses in the program, also representing the International Association of Forensic Nurses.
Glad to have you. Heather Deming?
Good afternoon. Welcome. I'm waving. I just don't have a camera on this computer I'm using today. I am a representative for the Connecticut Emergency Nurses Association, past president, as well as former SAFE member on the team back in the day, and ER nurse of 20 plus years now.
Thank you, Heather. Dr. Jubanek?
Hi, Karen Jubanek. I'm an emergency medicine physician and also represent CSEP, the Connecticut chapter of emergency physicians.
Thanks, Karen. Sevi?
Hi, Sevi Papakanakis here. I'm the Deputy Director of Forensic Biology and DNA at the Forensic Lab.
Thanks, Sevi. And Robin?
Hello, everyone. Robin Towsey Ayers. I am on staff at the Connecticut State Department of Public Health in the Office of Injury and Violence Prevention.
Great to have you, Robin. And Sherry, I hate to put you on the spot because I know you just popped on, but you're the last of our voting members to do introductions.
Hi, everybody. I'm Sherry Watson. I'm the representative from the Connecticut Nurses Association, and I'm also at Iona University and over the state in Westchester County as their Dean of Nursing.
Great to have you here, Sherry. And our guest introductions, we'll start with Melissa.
Good afternoon. I'm Melissa Patterson, counsel with the Judicial Branch's Legal Services Unit.
And Sarah.
Good afternoon. My name is Sarah Moriarty. I work at the Connecticut Department of Public Health in their Office of Injury and Violence Prevention.
Great. Glad to have you all here. Thank you all so much. Janet Mantello, our Safe Administrative Assistant, is here as well, very nicely, kindly sharing her office with me. She just informed me that we do have a quorum of 9 members, which is a great turnout for this group. It's 10 now. I really appreciate it. So it's great to have so many organizations represented. With respect to everybody's time, we're just going to jump right into our agenda. We have a lot of things kind of planned and updates for today, and I can't wait to hear from everyone. I will just say that I will be filling in for Mark Pelka, who the director of OVS, who had some conflicting important meeting schedules, so we had to separate, and I will be covering his report out for the committee. So just bear with me, but we'll get through all of that. So our first agenda item on the schedule is, I believe, the Safe Response Program report out. And Oh, I'm sorry. I made a mistake because my agenda is back in my office. So we'll start with the approval of the November 12th, 2025 meeting minutes. Did everyone have an opportunity to review the minutes? Okay. And are there any suggestions for revisions or edits to those minutes? Hearing none, is there a motion to accept the minutes for the November 12th, 2025 meeting?
make
Motion
the
from
motion.
Heather.
Yep.
I saw Marielle raise her hand first. I want to say Marielle raised the motion to accept the minutes. Heather seconded for that minutes. All in favor, say aye.
Aye.
Raise your hand on the computer so we can get a vote
Aye.
count. Perfect. Awesome. Thank you so much for the record. All right, so the November 12th, 2025 meeting minutes are accepted. Moving on to our next agenda item is the Safe Response Program report out. We're doing really well, still on that steady climb. December, January, and February have been really hard months, both weather-wise and with activations. Hoping that it's not necessarily an indication that there are more people experiencing sexual violence, but our consistency and the ability to know that we're getting the word out that we're there is also encouraging hospital staff to activate the program and reach out for help, which is what we want. We want the hospitals to call us when there is a patient that presents so we can provide our expert care for them. So the SAFE program has been rather busy. In addition to that, we still maintain a roster of 41 safes. There are 26 active safes because we are currently having 10 of our safes on a leave of absence for different things, which can pose a challenge scheduling wise as well. Things that we're working through and really giving us a lot of information as far as knowing that the numbers of safes required for the response program to meet the standards we set really is higher than we initially anticipated because of all those percentages of the safes that are potentially off the calendar for different reasons. And then we have 5 preceptees as well. We recently closed on both our hospital application. Hospital application closes on Thursday, the 12th, and our response program application closed at the end of January. We are currently going to add 5 additional response safes will be in this next class, and we've received 36 hospital applications thus far, which is the highest number of safes. We are going to be able to accommodate those numbers in our current space here at OVS. We've had some removing of some cabinetry, adding some tables, so we will meet the capacity of that room. I refuse to turn anyone away, so we are going to be very tight group within fire regulations, but definitely, filling every seat that we have in that room. So I'm very happy for that. Looking forward to another really robust training year. And I just want to say again, which I just can't say enough about the commitment of the SAFE program contractors. It has resulted in a significant increase in our response rates from the 2024 calendar to that of the 2025. We still have a long way to go, and we are continuing to build the capacity of the program. But really, it's just an outstanding show of commitment that these nurses work second or third jobs to then still participate in the program as well. So it's really outstanding for that. So we're looking forward to the 2026 training year and really just working to get the word out that we're here. All right. And then the next second, give me 1 second. All right. So moving on to the SAFE training program update. So Mark did let me know that we are anxiously awaiting the start of the training program manager. That process has continued, and it should begin next month. We're waiting for that person to get the official start date from our human resources. So it's been great. There were many candidates, and we're very lucky that we had such a difficult decision as a panel to determine our next training program manager. So I'm excited for you guys to meet her, hopefully at the next meeting. All right. And moving right along, this is the part I'm very excited for. So I can't wait for Robin and Sarah to take it off. But our update of the discharge packet pamphlet, and I am going to, do you need me to share it, or would you guys like to share it? It's up to you.
You need to share it as the meeting organizer. I can't share.
Okay, no problem. I'll do that
Okay.
right now. And
You muted yourself, Rachel. Oh, on purpose, I guess.
Yeah. Did she come back? Oh. Mhm. Has Rachel returned?
Not yet, Robin.
Okay. Mm. Ready, set, go? Okay. Ready, set, go? Okay. So this is Robin, and Sarah Moriarty and I will review the pamphlet with you. Just to give you an historical perspective, and Beth Hamilton can certainly chime in here. The original pamphlet was produced in 1999, Beth?
It might have even been the first versions, I think, even predate the 1999.
So we were obviously not in the current century even with our material. So it was time to update the pamphlet that is provided in the folder for people who have experienced sexual violence when they leave the hospital. So after quite an arduous adventure of many months, years, we've come to our final version. We also were valiantly assisted by Lori Johnson from Converge. That's the marketing firm that assisted us with all this. Like I said, she was valiant coming to our meetings, listening to us, and making it all happen. So it's always easier if you can see it. The document is 14 pages. It's in a 5x7 format, so it's going to be folded in half. So it's not going to be, which is like a greeting card size. It's not going to be an 8.5 by 11, 14-page document. Just so you know, this is the cover page of the document, and I can't manipulate it. So
I'm going
maybe-
to do that for
can
you
you-
in 1 second. Yeah.
Sure, yeah. So as part of the process, we always have to get everything approved by everybody. And this went through many versions by this valiant committee and also state agencies, making sure all the colors and everything were correct. So this is kind of how it looks right now. You'll see that there are QR codes on it. The committee decided that that is the best place to go, or best way to go at this point. So the main functionality of the pamphlet, if you will, is that all the webinar, the web links and the QR codes direct the person to the website for the Connecticut Alliance. We were instructed early on by somebody in the know that that should be our methodology, that we should be building this so that people will be drawn to the website for the Alliance. So you'll see all these QR codes go to the Connecticut Alliance. These two, I don't know if you can see it. The top one goes to the SACI reporting system, and then the second one I can't see. The second one goes to tracking your SAC kit. And all those are contained on the website for the Connecticut Alliance. So, so that's the functionality of the whole document. And you can see there's a lot of detail on STD, HIV, testing options, treatment options. And I think if we keep going, yes, there's a table here that shows the names of the testings and the timeframes from when the testings need to be done or don't need to be done. And then it goes on to rights and responsibilities. The Office of Victim Services is listed in here with an explanation of the function that they will serve. And the legal services, also free. More QR codes that take you again to the Alliance. Here's the section on knowing your rights, the costs of the healthcare. Again, there's the link to the sexual assault crisis centers, if they need those, and some other information on the CDC database, Planned Parenthood of Southern New England, which covers Connecticut, the Office of the Victim Services, and the compensation program. So I can tell you that Sarah and I scanned this multiple times to be sure all the websites and the phone numbers are correct. I'm just looking, did we miss something?
No, it looks great. I mean,
Okay, so just go back to the Department of Public Health. And Sarah, I think that one is missing something. Asked to speak to, it should say someone. We have to correct that because we have the Adobe Pro and the correct font size and all that here. God, we went through this yesterday in detail again. Oh, it's endless. So, all right, we'll fix that one. And then everything else should be correct. Wow. And the
good eyes, because I read over it.
We were on this page yesterday specifically, so this is super frustrating, huh, Robin?
Yeah. So, yes, you just live and breathe it. I can't tell you how many times I've checked websites here and phone numbers. So the packet can be uploaded and distributed by the Alliance as needed. This will dwell with them now. And this will ensure that survivors and partners have immediate access to this important resource. It's very thorough. It's very detailed. The reading level is a bit high for perhaps the public domain, which I think is 4th grade now. So the Department of Public Health feels that it's probably a bit too high for the general public, but they don't want to withhold it because we know you need it desperately at this point. So at some point, they would like to take chunks of it, like the HIV chunk, the STD chunk, some of the other topics in it, and make them into smaller infographics or business card size information, but we can't control when our marketing group will ever get to that, and we don't want to hold you up at all. So we're releasing it as is. I mean, except for, I can't believe there's already a typo.
Easy fix, right? That's an easy
Yeah, we
fix,
can
so
fix
sorry.
that. So don't give it to anybody
I
yet.
won't.
And so that's about the size of things. We finally made it, almost. So the Connecticut Alliance will own this. There was a question asked about posting it separately somewhere, but I'm not sure how that would happen. It's, as far as we believe, it's going to be posted on the Alliance's website, so it'll be accessible to any and all from there.
Yeah, we can definitely get it up. I just sent you an email too about one other edit around our stuff
Really?
on there. Which is just our text and chat, which is just active during the pandemic. It's still on there. So I want to make sure nobody is looking for chatting or anything like that. That wouldn't be available on our website. We also have identified resources to be able to print some of them, as well as to print smaller cards that would link folks back to this, and then a number of the other resources that are listed within it. So we can connect offline off of this meeting and make sure that we get all that stuff corrected, or we can work on the design file ourselves if that's appropriate. And then we'll make sure that we work with Rachel to ensure that you have access to either the smaller cards we're talking about, or maybe in some limited capacity, copies for all the hospitals, and obviously work with you, Marielle, also.
Okay. So congratulations, everyone. There are those on the call who know this is a labor of labor.
I know. I feel like, is this, to fruition? What is the next steps? I hear what Beth says about finding a spot on the Alliance website, and then printing the availability to find resources to have some of those materials actually physically on hand, which would be great. But what is the responsibility as far as next steps to coming back to this document? Does it need to continue to be an agenda item on this, in this forum, or should we schedule it as a revisit annually, or is this item closed on this agenda?
I would imagine you might want to test run it for a couple of months, and come back in, 4, 5, 6 months and reevaluate it. Not just wait until something happens.
No, I think I think you're right. I just wanted to make sure that as far as this goes, for next steps, is DPH going to find a spot on their website as well? It was my understanding that that was initially where it was going to be housed, just for consistency's sake, but are we no longer working towards that effort? It will only be on the Alliance website.
Right. They felt it should just be on the Alliance website.
Okay.
That's where it should be housed. It doesn't mean there won't be a link for us and for anybody else, but they felt it needed to be housed on the website of the Connecticut Alliance. Have I missed anything, Sarah? Okay.
All right. That sounds great.
I can't believe we have a typo. I can't believe there's a typo.
I can't believe it's that page though, because that one page three of us were looking at together yesterday. So it's not so much we have a typo, it's that page that gets me. But
I think they're gremlins in these programs.
I think so too. I think somebody goes on our computers at night. It's just
It does feel that way sometimes. Any other questions for Robin or Sarah or DPH in general related to the pamphlet?
No, we do want to know how it goes as a working document. We also believe it's an excellent resource document for professionals themselves, even if it may be a little bit above the level of the consumer. It should serve as a good resource document for your professionals.
I like that.
I just think once we get them posted where they're to be posted, we can go from there. And like everybody said, we can monitor how the rollout goes as far as people knowing that it's updated and provided, and maybe eventually it can be a once a year revisit. But I think Robin's right. Like we need to, kind of be mindful of the rollout and the impact it has.
I think that's a great idea. What if I added to the next meeting agenda an update on the DPH pamphlet from Beth as the provider as far as the alliance and that status? Would that be okay? Working more towards how are we getting this to the people that would find it most valuable. So till we get it to fruition, I know we had talked about adding it as a QR code to some of the kit paperwork as well. So there's always other options that we can look at moving forward to getting it to the patient or to the stakeholders in this to really act as a resource, whoever's the most appropriate. So I'll do that for the next agenda meeting. I will, Beth, if you're okay with that, I'll add an agenda item for an update regarding the DPH finalized document. And then the other to do is just Sarah and Robin, when those final revisions are completed, if that could be shared, we would be happy to share it with the group as a whole, and then just direction on where it can be shared outside of that as well.
We're on it.
Awesome.
And Beth, you said you sent us an email. Great.
Yep.
Awesome. That sounds good. Very, very, very good. All right, moving right along. All right, so update on the 2025 technical guidelines and sexual assault evidence kit. Maureen, if you would like to, I know I have myself down as the agenda person on that, but if you want to go ahead, I have more than enough on this.
I only want to say thank you to all the members of the commission, and I know Rachel and many other members of the commission are on here, but I would think that you were probably the best person to present that, only to say that the commission has been working very hard. We've been meeting, I think, almost monthly since September to do this major renovation, thanks to the hard work of the members. So Rachel, I will turn it over to you.
Thanks, Maureen. And I'm just going to throw the kudos right back at you, because really, you came in here and got us organized right off the bat and really pushed the initiative to keep the momentum going. And I'm really grateful, because it takes that leadership to really keep a project moving and making the suggestion to put the work in. So I really appreciate all you have done with that as well. So thank you for that. As far as I'll start with the sexual assault evidence collection kit, which that is the easiest update to provide. CERSHI, as you know, gave an 8-week lead time back in December once the finalized artwork was completed. In contact with the company as of Monday of last week, they have stated that they are experiencing ongoing delays with regards specifically to cotton swab supply chain issues. I do appreciate that if there are alternatives offered, I would be reaching out to the lab to confirm that alternatives suggested by CERSHI to prevent any further delays would be approved by their unit to make sure that they meet all the criteria for what they would require for their samples and things like that through the Evidence Commission. But I am hopeful still that we will work towards our goal of getting those units received. I will be meeting with her on February 18th, so next week, to get a more accurate reporting of where that stands. So I'm hoping that I'll have even more information by the Evidence Commission meeting, I believe on the 23rd, if I'm remembering the dates correctly. So I'm hoping that I'll have a more accurate update by then. They are aware of the start of the class on March 17th, and they are also aware of the end of the fiscal year, wanting to get those that product received prior to then. So those are the two things with the evidence collection kits, but we are working towards those items. As far as the technical guidelines go, one of the things that was identified by the Evidence Commission is that this is a document that's going to be constantly under reevaluation and revision and working it as a baseline for growth. I think the Evidence Commission as a whole and the experts that are a part of that group have been phenomenal in identifying opportunities for clarity and improvements and utilization and an improvement as a resource and just the simplicity of it. So we're hopeful that the technical guidelines, that this is a baseline that we will continue to grow off of. I hope that in future iterations of this document, it looks more of a gentle transition rather than it changing structure drastically. So I'm hoping that as that goes forward, and I know that the commission members are all working really hard to make their pieces the best they can possibly be. So with that, I believe that the technical guidelines, the version that has been approved for posting by the commission, we're working to get that posted to the site, but they're for everyone watching and for this group as well, it will be constantly updated and notifications of those changes as sections are approved and or revisited throughout the year. So I look forward to that as well. Does anybody have anything else that they to talk about related to the technical guidelines or any questions you have related to the technical guidelines or the evidence kit? Okay. Great. Okay, so moving on to our next agenda item, exploring maintaining a safe certificate. At the last meeting, I had volunteered or tasked myself with identifying a pathway forward. And in reviewing all the materials that we've collected and the previous meetings and the large amount of information that we have to process to really come up with a definitive plan for future generations of safes. We broke it down into, my recommendation is going to be that we form 3 subcommittees potentially with the hopes of breaking down the work for more forward progress. And the 3 recommended subcommittees that I'm proposing is the first is expanding the training capacity. So I would really like to put that on hold till the training manager gets here, but we want to look at what's our plan for expanding training capacity. What does that look like? And overall, I'm calling that access. So we're trying to look and have that subcommittee focus on access, what we're doing now, what are our options, what are their goals coming forward. The other committee that we're looking at is continuing education, and think of that as excellence. So what are we counting towards the continuing education qualifications for safes? Is it quality assurance? Is it the educations put on by the IEFN like No Sane in Sight? Or is that something that should be evaluated and supported as a resource to the safes of Connecticut, to the healthcare providers of the Connecticut, and how does that look if we were to do it? So that is the continuing education subcommittee. And then the last is really maintaining a safe certificate. So that's really the sustainability piece of how are we going to move this forward through the years to make sure that we are meeting the goal that we have for the SAFE program, which is that every patient who presents reporting a sexual assault, every patient who presents to a facility deserves care by trauma-informed, specially trained healthcare personnel who know how to meet their needs in their time of crisis. So really that's for everyone. How do we meet that need for the state? And by focusing on subcommittees that address access, excellence, and sustainability, by coming back, I think we'll have a better plan moving forward. I don't think I have to make an official motion, but in the hopes of involving stakeholders outside of this, what I would love to hear any thoughts anyone has on that recommendation. Go ahead, Kristen.
I think that's an excellent idea, and I would volunteer to be the chair of one of those subcommittees.
Oh, that's great. Thank you, Kristen. Do you have a particular one that or one of them that's you're more inclined to focus on?
The last one, because I do have the SANE, the National Sexual Assault Nurse Examiner, SANE A credentials. So I think that through my work and education of keeping up my certificate, that one would be easy for me to chair and know what you need to keep that certificate. And then we could pass the ideas like I talked about in the other meeting forward, of how the SAFEs with this 3-year certificate can keep up their credentials for that certificate.
That's great. Thank you so much, Kristen. I really appreciate that. We can definitely talk offline about the details of how to reach those people. Heather?
Good afternoon. Absolutely. I agree with Kristen. This is a fabulous idea, great implementation for the SAFE nurses and program. And I'm also happy to volunteer and help out.
Awesome.
Maybe continuing education?
I think that would be great.
Okay.
Yeah, that's great. And so thank you, Heather, and thank you, Kristen, for both volunteering to chair 2 of those subcommittees. I think it's a really great foundation for this group. I'd like to hear input from our members as to which stakeholders we should engage to be a part of these subcommittees. So chaired by the members, but we want to make sure we have representation from the people who are the experts in these groups. If there's any committee members that want to be a part of one or the other subcommittees, or if you know of an organization that you think should have input into these into the goals of these subcommittees, please, any suggestions would be appreciated. Sherry?
So I'm happy to be a part. I just can't chair. I'm happy to be a part of either one. Maybe the continuing ed would be something that just because of my educational background. But also,
great.
are we, would you invite some of the very active SANEs that have been trained in to participate, as an option to want to participate? Because I would think that they are probably a very big key stakeholder in what they can do and what they feel is reasonable given their jobs and the landscape of nursing in the state.
Yeah.
And I mean, everyone probably has a little bit of a different opinion, even from organizations. So I was just, I don't know if that's an option to send it out to, anybody that wants to kind of volunteer.
Yeah, I think that is a great idea. I think we should set a limit on the number of participants for each of the subcommittees, and then a period of time for when people could respond. And then I would recommend that the chairs decide based on the responses. And I'm happy to help that with a forms doc. I think that that would be the most efficient means of using our email list from either the the 260 safes, right, that are certified in the state. I would recommend the Safe Response Program as well, its members as an option. I also would like to suggest the hospital liaisons. So all the coordinators that are health systems that were they to be involved. I know we have a lot of nursing professional development specialists, some which are SAFEs themselves that help organize, but for the hospitals to have a voice in what the requirements are, I think is really helpful in bridging that gap. You know, DPH, if you have a safe program committee, if you have someone that you know, if is interested, I'm happy to hear other suggestions of the group. With the topics, it does seem to run more towards healthcare, but I would be open to any other organizations that I'm missing for as a representative. With the vast, oh, sorry, go ahead.
So this is Robin. I just, so from here at DPH, if you're thinking of somebody, I
know who you're gonna say.
You do?
Dana Dalton.
Oh, I'm not sure about that. I mean, you may know better than I. You know, we had extensive contact with our HIV and STD staff while we were building the pamphlet. So, but you may know better who is the best to serve what you need.
I just know Dana, she's a forensic nurse over there. She's great. She went through the Quinnipiac class. But forensic nursing is a small world, so I feel like sometimes it just pops into my head, anybody who has a background in that. But
so Dana, and what's her last name?
Dana Dalton.
Dalton, okay.
Yeah.
Shall I let her know you're thinking of her?
You can, but I think she's probably busy with a lot of what she has on her plate. I believe she's leading regulatory over there. So, but I appreciate her input as a forensic nurse. You're more than happy to put it out there. I'm going to send the QR code for the options for the two subcommittees with every member of the group. So I think that with the QR codes, the way the responses come in, if there are people with interest, you know, having that list compiled. And then I do think that the two committees should be balanced. I guess I'm wishful thinking of, you know, if we have more than, say, 10 interested parties, that we should probably limit it to that range. Does anybody else have a number for what subcommittee size functions best? I feel like 10 is probably the most. Kristen or Heather, as chairs, how many members do you think would be a manageable amount within your subcommittees? Go ahead, Kristen.
Hi. I was on the subcommittee for the technical guidelines, and we had only 3 to 5. I know it was a different thing, but sometimes there's too many hands in the pot, so I don't know what other people are thinking, but
I guess it just matters if you can ensure enough attendance, right? You know, if people can commit to the timing
Right.
and cadence. But if you need, you know, if you need to have a little bit more availability, you might want to go a little larger to ensure that you always have.
like a jury, you can have alternates.
Yeah. And
Yeah.
just so you know, the expectation is that there will be one meeting of the subcommittee prior to our next Safe Advisory Committee meeting as an acting subcommittee. So there would be an expectation of a report out at our next meeting, which is May 13th. So in between now and then, we can connect and get that information out. And then the expectation would be just one meeting prior to then. and just some clarity on goals and what we're trying to, what information would be beneficial to creating a pathway to safe, maintaining a safe certificate.
Can I ask
Okay.
a quick question?
Sure.
Rachel, I'm so sorry. So I know one of the things you said in there is one of the goals of the Access Excellence Sustainability is meeting the goal of ensuring that survivors have access to appropriate care. Where do you see do you see a place for survivors or in any of those subcommittees, or where do you see that falling in terms of
That's a great
ensuring
question.
that it is like, you know, as quote unquote friendly, as accessible? I get that the focus really is on training, but how is the feedback loop for survivors who have gone through that process or who might want to give feedback around their experiences of or of advocates, right, who are with survivors very, very often in these settings also? Is that, and maybe that's not any of these subcommittees. I'm very happy to participate or to identify folks. I just don't know where it fits, basically.
No, and I do think that I think that it probably does fall under excellence, and that might be a bigger conversation for us to have outside. To be honest, at this part, I think you're pointing out a gap in our knowledge base, is that we're not having that direct connection with survivors and safes how we do the practice. Like, we're performing trauma informed, but really the impact on the survivors may be an opportunity that we can look into further. I'll reach out to you offline, because I don't think in looking at this that I was thinking about a survivor role in this, but you make
Maybe
a great
it's more
point.
that you have a like a you know, if you have a specific meeting about, you know, maybe they're not on the subcommittee, but if
Right.
there are, you know, and Beth would know how to sensitively approach people who would want, right? You don't want to necessarily, you want to approach people who want to be involved and have that conversation. And obviously some people are like, I never want to talk about this again, but maybe they have a part in, they're invited to one meeting to kind of give and then you get to take that feedback and, you know, work. So maybe they're not necessarily on it and making them have to be a part of a, you know, a committee, but to be able to
Correct.
have an opportunity to help inform the work of it.
Yeah.
We'd
Does
be
that
happy
sound-
to do that. I mean, even just to
Yeah.
pull advocates together to get feedback, because the challenge with the safe surveys that we get is like, there's only a very limited amount that we get, and they're either everything was great or everything was terrible. There is nothing in between those two things that we get ever on those surveys, and so it's not really a great like source of feedback that would give holistic feedback about how most survivors would experience that. But
Right.
I do think that there's probably really valuable conversations. I know I've even talked to some of your folks when our advocates have been your live models, right? And the conversation that naturally happens there would be helpful probably to some of these conversations. Certainly not everywhere, but just let me know how I can be supportive. I'm being quiet, not because I don't want to help. I just don't know where we fit.
I appreciate that transparency, truly. And I think your idea is spot on. And Marielle kind of linked the both. Great at building bridges, because I feel like you're right. It maybe isn't as a subcommittee member, but at a special meeting, both Kristen and Heather, maybe Heather more specifically with the continuing ed and excellence, having that relationships with survivors, I think could be tied into something in that subcommittee.
Happy to brainstorm whenever you want, Beth.
Sounds good. All right. Okay. Well, you all just made my day with 2 chairs of subcommittees that will help move forward on maintaining a safe certificate and exploring that further. I want to be cognizant of time. So we have about 35 minutes left. I have 2 additional items I just want to address. One of which was that the IFN recently disbanded their sexual assault, their Connecticut chapters of the International Association, all chapters of the International Association of Forensic Nurses. So we believe that this is a temporary situation not due to any sort of political issues, but all internal challenges that they're facing, requiring them to
Regroup.
regroup is a great word. I love that. Yes.
Consolidate.
Requiring them to regroup. So that being said, Kristen is going to maintain her spot on the evidence on this committee. And we have been in contact with external affairs talking about what does legislative language change look like. And so we wanted to talk to this committee really about the idea of what the Connecticut chapter of the IFN member of this committee represents for the committee. And in moving forward, what would be some potential options to rename that position? And we had some ideas. We were talking about, should it be a safe response program representative? Should it be a Connecticut Nurses Association representative, being that the ANA is already on here? Should it be a secondary ENA member they just started a Safe Sane subcommittee? So there's a lot of kind of ideas. Should it be someone from the hospital? Should we reach out to hospital liaisons and say we want a hospital-based safe representative? And how does that language look in legislation? So we really wanted to get your input on what your thoughts were on what that representative means to this group and how we could look for all other alternative legislative naming of that position and still maintain that same type of representation.
I think, well, in theory, right? I mean, it was a tie to sort of the national conversation on that. So I don't know that we have a good replacement. I mean, I agree. I don't want to lose somebody's expertise, but I don't know that there's anything that's gonna, unless there's another kind of national group out there I'm not aware of that kind of is similar. Is there anything out there that
the Academy of Forensic Nurses, so that's the AFN, but again, they don't have the same type of network that the IFN did, where state representation was kind of coming together.
Because I feel like in the absence of having that connection to the national organization, I don't know that we need, and we are the state conversation. The group of us here already represent the state as another level. So I don't know, do we need to even replace it per se? I mean, maybe it's just since there's no Connecticut chapter, is there going to be somebody still tied to the regrouping group? I guess I'm just trying to unwrap. I don't really understand, and I'm trying to unwrap this.
Yeah, so I appreciate the lens with which you're looking through, because for me, the Kristen's position, the Connecticut chapter president, was really forensic nurses. So to me, that position represented SAFE, was as close to the work as we get beyond the advocates, in the healthcare role on this committee. And I really do feel very strongly, I don't even know if one person is enough to represent that role. If it needs to be both someone from the response program and someone from the hospital basis. So I don't know what that looks like, or again, how do you choose, right? Like who gets a voice and things like that. So definitely challenging.
To your earlier options, like with the Connecticut Nursing Association, even they already have a seat on this table, and if they have a subcommittee, they might as well always. Yeah, they might as well always consider that person their representative. So I don't know, you need to revise that one. I don't know that that's worth the effort. You know what I mean? Worth the legislative change for that one, at least. Sorry, Sharon, go ahead.
No, I think that's the ENA is now the new subcommittee. The Connecticut Nurse Association didn't start a new.
Okay, I'm sorry. I might have gotten the wrong.
Yeah, no, I just wanted, so
would
would
the
it be
one already
possible
has
to
a
give
seat?
the ENA 2 seats?
But why?
Well, for the or unless the subcommittee, I mean, you're right. It should be
subcommittee
the person
person
who's
could
at
be
the
the
head of the
person.
subcommittee.
Yeah.
Right, like if
I
there
feel
was
like
a
it's not
subcommittee
worth
in
going through a
CNA, I
legislative
would.
change when they can already put that person in as their person here.
Oh, we have to change, we have to amend the language anyways. So it's.
Yeah, but I'm just saying, like, if you're going to make an amendment, make one that's helpful. Like, I don't know that that one's helpful because they can already put that person in the role for them, even now, without a change.
I understand what
Do you
you're
know-
saying now. Yeah.
you
so,
understand what
if
I'm saying.
There was
They
a
already have the
subcommittee. If I
ability.
wasn't on that subcommittee, which you would have thought I would, if it was in the Connecticut Nurse Association, I would have assumed that I would be on that subcommittee. Right. Yes. So I guess I understand that if the subcommittee for the NA, the other thing that you were saying, Janet, that was kind of interesting, was the Rachel, I'm sorry, was if the current safe response people, is there like a group that meets like could they select someone as their representative from there if you're going to amend the language? Like how cohesive is that group?
Oh no, they're close. I mean, Kristen is also part of that group, and we definitely have leadership and mentorship. We have I would say over 10 safes that have been with the program for nearly 15 years since its inception. So they're definitely a cohesive group, and we're building on that every year. I think that would also feel really good with having someone who's active clinically doing the medical forensic exams have a voice in this forum. It really is important to me for that. I just wanted to make sure that we are being inclusive of all safes and not necessarily, that's where I felt like, should it be even broader? Should it be an application process or,
But it's just anyone who has an active, I mean, anyone with an active safe certificate, right? You don't need to be more. Then it can be anyone in this state who's got one and they have, but I think what you're trying to elevate, we could have them here now all the time, but you're trying to elevate them to a voting position, right? I think that's the different, because we can always invite safes to be a part of this conversation. And I would say we should. I have always said I feel like they need to be at these meetings. But I think if we're adding them to the committee on in the legislative, then we're elevating them to a voting member. And in that case, Rachel, I think maybe we just say anyone with an active and current certificate can be. And that way you have a lot of flexibility. If other people need to drop off, then you have a bigger pool, an easy pool. You're not trying to pigeonhole yourself into a hospital-based one or a program one. It's just whoever is a certified safe in Connecticut has, and then I think it just gives you a bigger pool of people to work with to fill the role in case there's people needing to come in and out.
And then how would they be appointed?
You could give it I think you could put it under the program's appointment. I'm not sure. It's a question for other people with better expertise on appointings, which is not me.
I appreciate your opinion. I wanted to make sure that given that OBS already has 2 seats on this panel, I really wanted to make sure that we were gaining the input of the group to identify what would be the best course moving forward, right? And so, anyone could potentially nominate someone and then vote, and it would be appointed for whatever term we set, which I think is 2 years. So ongoing conversation, I think. I appreciate just the dialogue back and forth and some of the feedback. Oh, Kristen, did you have your hand up?
Yeah. I'm not sure with all the legal part of it either, but I mean, I've been on this committee since I believe 2019 through the IAFN as a representative for the Connecticut chapter. So although the Connecticut chapter has been dissolved, the International of Forensic Nursing, like the entire thing hasn't been dissolved. Like I'm still a member of the International Association for Forensic Nursing. It's just the chapters that are maybe temporarily not there. So it could still be an IAFN representative. Maybe you wouldn't have to change it. Just take out the Connecticut chapter part, or
But again, like,
But I just-
how
I
does
don't
the
know.
appointment part of the language work too, I guess, is, because I'm with you, like, if it's
But I'm
easy enough
also,
to
like
just
you
keep
said,
that.
I work for OVS. I'm also an ENA member because I'm also an emergency room nurse. So I mean, it could fall under any category, I guess, but
Yeah, it's
as
just, I
far as
think how
future
the way
appointments, right.
the appointment language currently says, and then if you need to take out Connecticut chapter, or, but it's definitely a good point to review it
Yeah.
in that lens as well. How can we work with IFN now if we can, and if not, then how do we try to bridge the gap?
Right. Kristen, that's a great point, though. Still having that affiliation with forensic nursing is really important too. So I wrote that down as another kind of potential criteria. But okay. Does anybody have any questions related to the regrouping of the IFN, restructuring, anything like that?
Just a question, does anyone know if they think they'll regroup in a way that will establish like state chapters again?
I think that they will, but the rebound will probably be lengthy. They had significant struggles, and we are positive, though. One of our safes in the program had applied to one of their Centers for Excellence internships sponsored through a grant through the IFN. Initially, when they had their regrouping, that had fallen off, and then she recently was reached out by one of the members saying we're able to refund this. So and so she's going through with the grant funded experience for Centers of Excellence. She's going to Shelby, Tennessee, I believe. Tennessee, Shelby County Forensic Center of Excellence, I believe. But so yeah, so I'm hopeful, and I think that everyone's outlook is positive, but for right now I think it's just just as anything, a rebuilding is very long process. Does anybody else have any new business or identify any topics that they wish to bring forward with this committee? Okay. Right. Hearing none, does anybody want to make a motion to end the meeting?
So moved.
All right. Sounds good. We have a second.
Second.
Need it? Sounds good. All right. Well, thank you all for a very wonderful, productive meeting with some great dialogue, some great ideas. The minutes will go out next week, and you all have a wonderful, long, hopefully fun weekend. And thank you all for being here.
Thanks,
Hi,
Rachel.
everybody.
Bye-bye.
Thank you. Take care.